Thanks for joining us. I'm Nancy Furness, and this is We've Got Issues. Our interviews are taking place at Coquitlam City Centre Library, and we'd like to thank the library for providing us with a venue for the interviews. And just before we get started, I'd like to acknowledge that the interview is taking place on the traditional, ancestral, and unceded lands of Coquitlam First Nation. So we thank the Coquitlam people who continue to live on these lands and to care for the lands and the waters and all that lies above and below. So joining me today is James Musgrave, and he's here from Share Family and Community Services. So thanks so much for joining us today, James.
Happy to be here.
Now, you are the Director of Counselling Services and Programs?
Yes, Programs and Services.
Programs and Services for Share. Can you tell us, first of all, a little bit about who Share is? Most of us, I think, are familiar with Share in the community. And then tell us what your role is as the Director of Counselling.
Yeah, for sure. So Share is a nonprofit agency that sits in the Tri-Cities and provides a wide range of services for all ages, really. The way that we look at our services, or one of the ways to anyway, so we kind of divide it up into separate but overlapping vulnerabilities. So I won't necessarily go through all of our programs, but I can give you a sense of the areas that we touch on with our work. So one vulnerability would be financial vulnerability. You know, this time of year, that's front and center.
Right.
People are struggling to make ends meet and make Christmas be special, whatever that might mean. So we have food bank, rent bank. We've got affordable housing that we provide through our sister agency, 43 Housing. And we also have legal advocacy and employment programs to help with financial vulnerabilities. And then we're going to talk more about the mental health vulnerabilities. That's why I'm here today. We also have a focus on aging as a vulnerability, so we offer housekeeping services, grocery shopping assistance, transportation to doctor's appointments, as well as social connection programs under that vulnerability. And then when we look at disabilities, we've got programs for specialized therapy for children with supportive needs and one-to-one supports and social skill building groups for youth and young adults with neurodivergence. And then we do a lot of work with the newcomer population too. That's another vulnerability. So English language practice groups. We've got services for refugee families with little ones, and we offer counseling support there as well. And then lastly, we've got the early and middle childhood years, which is a lot of programs focused on parenting supports and supporting and one-on-one services with family support workers. So that's kind of an overview of all the things that we do at Share.
And that's just an overview. It always amazes me how much Share does in this community. So a very well-respected entity, and certainly do give a lot to the community. So thank you for that.
Absolutely.
Let's talk a little bit more about the counseling side of things.
Sure.
Can you tell us a bit more information and maybe some of the programs that you run specifically with respect to counseling?
Yeah, sure. So as the Director of Counselling Programs and Services, I get to oversee all of our mental health focused programming, which is great. I've been with Share for just over 6 years. And the best part of my job is that I get that clinical oversight of our supervisors that we have and our amazing staff. And so we offer a number of different counseling programs that I can walk you through. All of the counseling programs and everything else we do at Share is free, so it's important for people to know. So that's takes away a huge barrier for many folks, right? Yeah, a lot of what we're trying to do with our services is eliminate barriers to make it easier for people to access and get the supports that they need. Yeah.
So you mentioned that you have for all ages. What age what's the earliest you would start counseling age-wise?
So specifically for counseling, we do have one of our programs called the SEEDS program, and that focused on the little ones, 0 to 6. The referrals for that program come through Child and Youth Mental Health, or MCFD, the Ministry for Children and Family Development. And that's we have a fantastic play therapist that does that work.
And then you have even counseling in different languages, is that correct?
Yes,
I think
for
you have
sure.
no Farsi speaking.
Yeah, so in terms of languages, we do our best to hire people that have second languages, which is great. And then we also are lucky enough to have access to translation services through an agency that provides that. And then we also have access to the provincial language bank. So that means that we can call them up and say, we've got somebody that we're working with that speaks that particular language, and they can connect us to somebody that's able to translate.
Right, and that's another huge barrier
Yes.
right? Language barrier could stop somebody from seeking the help that they might need. And then do you do family counseling as well, or is...
Yeah, we do. So our community counseling programs offer 3 different types of counseling. There is family counseling. So we've got a counselor there that works with the whole family, regardless of age. We're just looking for people that have somebody 18 and under in the home,
Right, okay.
and have the focus, where the focus is on working with the family. You mentioned our Farsi speaking counselor, which is, we do have a number of Farsi speaking counselors across of our programs, but we have just started a Farsi speaking counseling program where the sole purpose is to work with the Farsi speaking community in the Tri-Cities. Yeah.
And then I have to ask, on behalf of seniors, is there seniors counseling as well?
So nothing specifically for seniors in terms of counseling. I mentioned some of the senior services that we have at Share, but seniors can access the majority of the counseling that we've got. Some of them are specifically for families or younger age people, which I can go through them, but certainly are a number of them that are open to people of all ages.
Okay, so it's good to know there's a wide variety of counseling programs available. Can you also, you mentioned about legal advocacy.
Yeah.
Can you talk a little bit about that? What is the legal advocacy program?
Sure.
What are you doing there?
Yeah, we're lucky enough that we've got 4 staff that are legal advocates. So they always remind me we're not lawyers, and it's important that people know that. But we focus on 3 different areas. We focus on poverty law, and so that's a focus on people's finances. The worker there does a tremendous job helping people with forms, really, and navigating the system. So people might be eligible for employment assistance, persons with disability, other things, and either not know that they are or be unable to wade through the paperwork and navigate the system. So the poverty law advocate helps people navigate the system and get access to fundings that can support them.
Well, it's wonderful to know that that support is in place, because I think you can get very lost trying to navigate your way through there if you're not familiar with the system, or you don't have the computer skills or access to a computer.
Exactly.
All of those sorts of things can, serve to keep you from getting the benefits that you really do need.
Yeah, and sometimes forms are just scary and nerve-wracking to fill out. All the details, you don't want to make a mistake, and it's nice to have somebody that can help you find the right forms, find the right things, and then help you fill them out.
Yes. Yeah. And then what is the other branch? You said there were 2.
Sure, 2 more. So family law is another one of our advocates, and their role is to help people through, again, it's a lot of system navigation around the court system for separation, divorce, custody, access, things like that. So
very stressful, potentially stressful situations.
Yeah. So they can support and advocate for people around, again, how do they start a process, how do they follow through, what happens when they go to court, just to try and take away as much of that stress as possible. Yeah, and then the last one is a tenant advocate, right? And that position helps people that are dealing with possible evictions or just a variety of tenancy issues that may come up.
Right, and I think we hear more and more about that as our affordability sort of gets more and more difficult and challenging. So again, a very important area to be providing support for. Yeah. So, there's so much that you provide, and I think life in general is becoming increasingly complex, maybe more stressful. People are faced with challenges and increasing challenges all the time. How are there some signs that people can be aware of themselves so that they know that, the time has come, I do need to reach out for help? We all have bad days, but there's a difference, isn't there?
Yeah, that's a good question. I mean, it's the easy answer is anytime's a good time to access counseling. When we think about the programs that we offer, they're a little bit more specific, and I can go through them with you maybe after this question.
Sure.
But really, it's for people when they recognize that they're no longer able to manage whatever that thing is in their life, right?
Things
so substance use is. Yeah, so substance use is one example where lots of people may consume one substance or another, and it doesn't necessarily interfere with their life in one way or another, but when it starts to become a problem, right, is when it makes sense to reach out.
So when it starts to have an effect on your day-to-day life, it's not just having a drink on Saturday night socially, it's becoming a bigger
Yeah, and you can say that with any issues. Stress, we all experience a certain amount of stress in our lives, but when that stress seems to be constant and overwhelming and becoming too much, where the stress is interfering with you even being able to go to work or address the issue in front of you, I kind of think about life as being a little bit sticky. Right, and so as we move through life, stuff gets stuck to us along the way. We all have different ways where we clean it off. Some people play sports or go for walks and have different things that they do to take care of themselves. And counseling comes into play when that sticky stuff just collects a little too much of it. Collects and it starts to slow you down.
Yeah,
right?
that's a really good visual way to think of it, right? So what about children? Like, maybe we know in ourselves when things are getting overwhelming. How do we see that in children, or how do we help children to understand when they need to reach out for help too?
Sure. Yeah. So there's a couple different ways. Like when we think about working with especially younger kids, sometimes it is working with the parents. Right. So some of our programs will provide support, and the referral might be for the child, but they may do a lot of work with the parents. Thinking that if we can support the parents to better understand what their child is going through or develop skills or their own self-care to be able to better manage themselves when they're interacting with their youth. So that's one way to do it. And then we do have family therapists, play therapists that will work specifically with the little ones. And that's really, as a parent, it's the same thing. It's those struggles where maybe you've received some support of one kind or another, or you've read a book or watched a video, or the school has maybe given you some feedback and you're really just not sure what next steps to take to support your child. Counseling can be one avenue to help.
Okay, it's good to know that it's here when we need it too. Did you want to talk a little bit about some of the programs? Sure. You mentioned that there were several. Yeah, for sure. So I mentioned substance use just a minute ago. So we have 2 substance use programs, the adult substance use program, and so that's for people that are 25 and up. And then the youth substance use program, so ACES and WYSIS we call them. WYSIS is focused on 12 to 24. People can get to there by referring themselves. Oh, okay. So it can be voluntary, just I'm ready to come in.
Yeah, ideally that's the way all of our referrals, not all of them come that way, but for all of our counseling programs, we really do want to talk to the person that is going to be coming for the counseling. It can be great to have people and other services supporting you and encouraging you to reach out, but ultimately we want to talk to that person to make sure that they're ready to engage and that what we have to offer is the right fit for them.
It sounds respectful. The respectful approach as well.
Yeah, for sure. We also have problem gambling counseling. I know you mentioned Adrienne off air, and I think she's probably been on the show. Her and Heidi do wonderful work with people that are struggling with gambling as an addiction, which is great. And again, that's a self-referral process.
It can be kind of a hidden one, right? Yes. Like maybe not everybody can see that you've got that issue. I know we went to a concert at the casino a while ago, and not actually going into the casino itself, but we were asked for identification. And I asked when we went in, like, why are you asking for identification? I was just curious, and they couldn't answer, but I'm assuming that maybe it's connected with people that are vulnerable going into the casino. And
it could be. I mean, I think they serve alcohol there, so they might be just checking to make sure that you're of age.
Oh, but, I don't think so.
But I always like it when they ask me at the liquor store. But sometimes people can voluntarily register to be on a list where they're asking different casinos and other places to gamble to not serve them when they come in. So it could have been that they were just checking to make sure that you hadn't registered to be on that list.
Right.
Not sure.
Okay. Well, thank you. I was just curious about that.
For sure. Another one of our programs, I talked about our community counseling program, so family counseling, Farsi-speaking counseling. We also have a counseling program there that focuses on refugees, so people that are new to the country and dealing with all the complexities that come with trying to figure out a new culture.
Not just left, but what they're coming to, and that transition. And that could be very heartbreaking and much needed.
Absolutely.
I think.
Yeah, for sure. And so all those programs that I've mentioned so far, people can just call and refer themselves. Okay. The other counseling programs that we've got our primary care network program, which we do in partnership with Fraser Health and the Fraser Northwest Division of Family Practice.
And what would that be?
Yeah, so that program is open in that it can be for any issue, and it's a referral that comes directly from doctors. So we work with doctors that are a part of the Division of Family Practice, and we built this program because they realized that people wanting to talk about their mental health were taking up a lot of time in their doctor's office,
interesting,
right?
yes.
And they also recognized that they weren't necessarily the right people to have those conversations. So they worked with us to build a program where they'll obviously meet that patient, and then they can make a referral to us, and we call them the patient, and they become our client within 48 hours. And then we set up an appointment a number of weeks down the road.
In 48 hours, you're making that contact?
The initial phone call, yeah, for sure. The appointment sometimes, depending on how busy our staff is, can take 3, 4, 5 weeks.
Right, but at least you know you're not forgotten.
Exactly, yeah. And that was a big part of it when we built that. The doctors wanted to know, and they wanted their patients to know that somebody would be there for them. So that's one.
And that's interesting, because something that we maybe don't think of is that a lot of mental health issues do end up in the medical realm, and then taking that out of there, putting them where they can actually be effectively addressed and resolved, eases up on the medical system too. Exactly. So it's, that's an interesting point.
Yeah. And then the last program that I'll mention is our Child and Family program. So that's for 6 to 12-year-olds. And that's gate kept by the Ministry for Children and Family Development.
So those are referrals?
Yeah, and so those referrals come primarily from social workers, sometimes from the mental health clinicians. And those are typically for families that are involved with the ministry. So they may have had a child removed, or they may be concerns and the possibility of needing to remove. So we have counselors and a great team of family support workers that we can plug in to either help families stay together, or if they have a child has been removed, they can help bring them back together.
Right.
Yeah, so those are all of our counseling programs.
Wow, that's a lot, and that's just one aspect of SHARE. Like, that is huge. So why is it so important that people actually take advantage of this and do the counseling? What is the ultimate goal of the counseling? Yeah,
so you can tell by the number of programs that we've got that the focus is different for each one. So the goals are a little bit different, but also ultimately it's about asking for help, right? It's recognizing that I haven't been able to do this on my own, right? And so a lot of times people think about counseling or just asking for help in general as a negative thing, as a sign of weakness. And really we look at it quite differently and say, to recognize for yourself that you're at a point where you could use some help, that's a display of strength, right?
That's a step in,
It's like, you know what, I want to solve this, and I recognize that in order to do that, I think I could use a little bit of help.
Yes.
Yeah, so for me, it's our goal is to help people deal with that sticky stuff that I mentioned earlier.
So you give them some tools to work through whatever the issue is, and so can you, a lot of people haven't actually accessed counseling yet, and there might still be that sort of hesitation because they don't know what to expect.
For sure.
Can you walk us through just what typically would happen? You get that phone call, you make that initial point of contact. What happens after that?
Yeah, so once
just a typical session.
Sure, yeah. Once you get to your appointment, counseling is really about relationships and conversations, right? So it isn't that foreign in that we have relationships and conversations in our family, at our work, everywhere that we go.
Right.
We have conversations with people. It's just a very unique type of conversation, right? And so people come, and first and foremost, our job is to listen. Right? What brings you here today? How can we be helpful? Right? So the first session, sometimes even more, certainly part of it is spent listening and getting an understanding of what brings that person here. That listening leads to kind of identifying what issues that they want to address, which it leads to setting some goals. Again, sometimes that happens all in the first session. Sometimes it takes a couple to get there. And once we've got those goals set, it becomes working, it's a partnership, working together you mentioned skills, so learning some skills, processing what's gone on in their lives, the way they view the world, and seeing how we can help them do that in a slightly different way. to help them move things forward. So ultimately, I always jokingly say to staff and the students that we take on, in counseling, our goal is to make ourselves irrelevant. We want our clients to be able to come in and go, you know what, I think I got this now. Right? Based on what we've done and what I've learned and what I take away from this, I don't think I need counseling anymore.
I know how to navigate myself through this. Do you think that sometimes it's the first time that people have actually been listened to or had that opportunity to tell their story?
It's a different type of listening, right? So sometimes people will say, well, I've got people in my life that they'll listen to me, but they don't necessarily hear me. Right. The counselor's job is to not think about themselves as much as possible. Have that hour that you spend together be as 100% about you as it possibly can be.
Focused on you.
Right. You know, and when we're working with people in our lives, that's tough to do. Everybody has kind of their own interest in there somewhere, even no matter how caring they are. And so counseling that's part of what sets counseling apart. Is that relationship it can be weird to say I'm going to talk to a stranger about my private business, but actually part of what makes counseling work is that person isn't connected to your life.
And not judging.
Yeah.
Right? Can make sort of an unbiased assessment. I don't know if that's the right word, but a non-judgmental, so you can feel free to just tell the truth.
Exactly.
Be very truthful and open.
Yeah.
How do people access this? You mentioned that it's voluntary and no charge. Sometimes it's a referral through a medical doctor, sometimes through the ministry. For the ones that are just coming in voluntarily, what would they do to access this service?
So the easiest thing, two things to do, if you have access to a computer, would be to go to our website, which is www.sharesociety.ca. Right, and that's got all of our programs, not just the counseling ones, but all the other ones that we mentioned there. And so you can look through and see which one you think might be the right one for you. Right. The other thing that you can do is just give us a call. Right. So the number you would reach us at is 604-540-9161. You'll end up talking to one of our wonderful program assistants, and they will either take information and get the ball rolling for you or redirect you to the right person. We also do have one of our staff that's an intake worker, and so some of our programs get processed through that role. But by calling that one number, they'll redirect you where you need to go.
Okay, sounds good. So it's an easy process. Just make the phone call.
Yeah.
Now we know that the holiday season is coming up, and quite often, well, we always think it's like this time of great joy and buying gifts and eating and getting together with friends, but quite often it can be a tough time for people. Absolutely. And it's not such a happy, joyous, time of the year. Do you have any tips for folks to maybe try and get through the holiday season? And is there any advice you can share?
So I don't know if they're tips per se, but I think that a lot of the stress that comes with the holidays comes around expectations. Right, so managing expectations would be one thing to consider. There's that belief that Christmas or maybe New Year's will fix all things, right? That families will magically get along, relationships will improve, life will suddenly feel better because it's January 1st.
Those TV shows that everything works out.
Happily ever after, right? That we all really want, but sometimes we build Christmas up to be the holiday time that it is, and that somehow it will fix all those things. So for me, one piece would be like trying to manage those expectations.
Expectations are unrealistic sometimes.
Yeah. I think, and the other one would be there's a tendency that people they're aiming for the holidays to be perfect, right?
Too much stress on yourself.
Yeah, the perfect decorations, the perfect meal, the perfect gift, or the right number of gifts. Again, that perfect family moment, whatever that might look like, perfect doesn't really exist, right? So I think that it's really, really heightened around the holidays that things have to be just so, and I think if we could be okay with being a little imperfect, that would probably be helpful too.
Be kind to ourselves.
Absolutely.
And I have one little piece of personal advice that I would say: get out into nature, go for a walk, and just enjoy what we're surrounded by. So there's so much here to be grateful for, and it's easy to get caught up and put so much stress and pressure on ourselves that we don't need to do that.
Yeah, getting outside is always a good idea. Yeah.
Can you tell us, during the holidays, a lot of things shut down, of course, and a lot of services are closed. Is there somewhere where people can go if they need 24/7 help
Absolutely.
throughout the holidays?
Yeah, so we're lucky in that there's a number of different numbers that people can call. And with all of our clients, we always recommend for outside of office hours, weekends, that type of thing, we encourage them to use those types of numbers. So, there's the Fraser Health Crisis Line. That's a local number, 604-951-8855. There's the Provincial Suicide Support Line, which is 1-800-SUICIDE, which is 1-800-784-2433. And then there's also a new line. It's come out in this past year, 988. And that's
just 988.
Yeah, and so that's a nationwide number that's really meant to support people in crisis thinking about suicide. So there's a number of one that people can call, and it's really what you feel most comfortable with. All those numbers and the volunteers and people that run them are fantastic. It's just about finding the one that you think is right for you. And there's a host of numbers that are more focused on seniors. There's some that are focused on youth. So there's a lot of information out there. I can leave you with some information that you might be able to share.
That would be great. We can add it on.
Yeah.
Yes. No, I just thank you so much for coming in, James.
Yeah.
I think you've told us a lot about some of the services that are available out there, and a little bit about, coming up to the holiday season, and if we need help over that time, where to go. And I really appreciate the work that you do. So thank you so much for coming in and speaking with us today.
Thank you very much for having me.
Thanks for joining us. You've been watching We've Got Issues, and we've been speaking to James Musgrave from Share Family and Community Services.